All right, I'm gonna show you guys how to do a Foley catheter insertion. We do both male and female Foley catheters. So first thing I wanna do, of course, is always check your order, visit your patient. I'm gonna clean this table off with a facility approved cleaner. These are the sandy wipes that we use here. Make sure that as I do this, you are checking your facilities policy and procedure as well as your checklist for your checkoffs if you're doing a checkoff for nursing school, because that is the expectation that you follow that. This is just to give you guys kind of a demonstration. So I'm gonna always ask my patient, have you ever had any issues with Foley catheter insertion? Are you allergic to any iodine, shellfish, any contrast dye, any kind of allergies? And our patient is not. If you are doing it on a male, you need to also ask if they have any prostate problems, and especially with that difficulty with Foley insertion. So we have the mannequin set up to be a female. I'm gonna kind of show you guys how to do that on her, and then I'm going to change out the body parts and show you guys with the male. So this is clean and dry. I'm going to prep my patient. So when you prep your patient, you have to make sure to pull that up. Give them as much privacy as possible. You always want to pull the curtain, pull the door. I'm going to raise this. You want to help the patient get in a comfortable position. So for that, I'm going to separate her legs like this. Males, you can do it this way as well. Some people keep the legs together for the males because it does help lift up the scrotum. But we're going to do it this way. During this time, you definitely want to perform perineal care. When you perform perineal care, you want to clean the patient using a different side of the cloth, a different corner of the cloth, soap and water, and then rinse with water, and then dry. You want to make sure that they're nice and clean before you do anything on them. So I'm going to pull my table a little bit closer here. You want that table at good working height. In our kit, there is some iodine, which is what we would use on our patients. However, because it's a mannequin, we don't want to use iodine. So I do have these simulated swab sticks. They're basically just like a clear stick. So there is going to be a point in time where I'm going to swap these out. And when I do that, I will technically become no longer sterile. But I'm just doing it for this specific demonstration. Make sure that you use whatever is in the kit on your actual patient, as long as that's what the policy states. So I'm going to set this off to the side. When you open this kit, you definitely want to make note of the size of your kit. I'm going to open it up by pulling. You guys can see the little paper part right here. When you take this out, be cautious that all the supplies don't spill out. I like to keep this paper for documentation. It helps because it reminds me of the size. I'm going to set that off to the side. You need to have this part right here. That's how you're going to label the Foley catheter. So I'm going to set that off to the side. Now, when I start to open my kit, you always want to open the first flap away from you. Remember, everything's like an alligator. I don't want it to bite me. So I'm going to open this part of the kit away from me. Then you'll see there's two flaps here. We're going to open up the flap here and the other flap here. Now, some kits are a little bit different. I have a drape right here. Not everyone uses the drape, and that's completely fine. I'm going to show you guys how to use the drape. Some kits have the drape underneath the fourth flap, and some don't. In this case, we've got it right on top. So I'm going to go ahead and lift it. Remember, with all of our drapes, you want to be sterile, so we're going to open it in a sterile fashion. I'm touching only that border. There is a dull side and a shiny side. You want this shiny side to be down. So when I do this, I'm going to put it like a blanket. So you can just kind of drop it and go under your patient and straighten it out. Okay, again, not everyone uses these. Then within our kit, there are Castile wipes. You could do perineal care at this point in time with these Castile wipes, but I've already verbalized that I've done that. There is hand sanitizer that you can use if you want to. I happen to have hand sanitizer right here, so, you know, perform hand hygiene as always. Now that we have the 3 sides out, you want to open up the other one. Make sure you don't reach into the kit yet, and you're gonna pull it down. I like to then turn my kit like this. Okay, I'm gonna reach in and get my sterile gloves. I'm gonna come off to the side. The reason I'm coming off to the side is because I cannot cross over that sterile field. I'm gonna open up these gloves. You can watch my donning sterile glove video if you want to see how to do that. I'm going to reach in here. And you guys will learn if you like the sterile gloves in your kit or not, in which case if you don't like them, just bring in your own. I'm not a big fan of these, so if I have difficulty, I'll use some of my others. Okay, it's sterile. I'm going to move it. Now, I'm going to go to my kit and I'm going to start to arrange my kit. There's a sterile drape right here. Again, not everyone uses this, but because it's part of the demonstration, I will use it. Right now, I'm sterile, so I can touch anywhere. When I put this down, though, I need to make sure that I can see my hands the whole time. So, you can see, I'm just gonna kind of drop it. Okay, going back into my kit. Here, we're going to pretend to pause for a second. This is the iodine swab sticks. This is the regular swab sticks. So we're just gonna change those. So, what I need to do is I need to tear open my swab sticks. Everything in this kit is sterile and my hands are sterile. So at this point in time, I can touch pretty much anything. Drop that inside my field. This, make sure you use the right one. This right here is just sterile water. Make sure it's sterile water and it's not just a random water. Make sure it's what comes in the kit. So I'm gonna take off my cap. You want to connect it to the balloon port because this is what I'm going to use to inflate the balloon. So this is the balloon port. I'm also going to take my Foley out of this blue paper. You guys can see I'm kind of coiling that Foley right here because I want to make sure that doesn't just flop around. Insert it back in there. Now here's the lubrication. There's a couple of different things that you can do with this. Most people like to put just a little bit on the tip part of their Foley catheter. Most people use a lot of it, but because it's a mannequin, I'm not going to. I'm going to set this off to the side here because I am going to show you guys how to do it a little differently with the male mannequin. Okay. You want to put the lid back on your tray, put the tray back in the middle. Now, we need to move this tray over to our patient. So when you pick it up, remember hands are sterile, so I can only touch in this inside part. I'm going to bring it over here and set it down at my patient's legs. Now, if I want to situate anything, I can only touch inside. I'm going to put this here. Okay. Now I'm going to choose my clean hand and my sterile hand. Now my sterile hand is going to be the one closest to the supplies. So take your clean hand. You're going to spread the patient's labia. Make sure that when you are doing this, your hand stays in the spot. Once I start cleaning, I don't move. You're going to take a swab stick, clean right down the middle, and then you can either drop it or move it off to the side. Make sure you never cross back over. Grab this off to the side, either drop it or move it around. Same on this side. So you go down the middle and then go side and side. You may need more depending on your patient, but remember my hand stays there at all times. Now I'm going to pick up the Foley. You want to hold the Foley about 2 to 3 inches from the bottom, or from the tip of it, and then start to insert it into the patient. If you have any difficulty, I would tell the patient to bear down. So we're going to insert. All right, I'm going to tell my patient go ahead and bear down. So that's basically telling her push down like she's trying to have a bowel movement. Once I start to see urine flow, we're going to verbalize that we see urine flow. I'm going to go in a couple more inches, usually about 2 to 4 inches, depending on your policy. Okay. Now, I'm going to use this cleanish hand and hold that tubing right there. You want to take your sterile and reach under. And then you're going to start to inflate this balloon. Throughout this entire time, if at any point you start to feel resistance, then you need to stop. You might have to rotate the Foley a little bit. Okay, so now I've pushed in the fluid. I have to hold this plunger because if not, you see it's kind of going back. So I want to make sure to hold that. You're going to pull back on the patient just a little bit to make sure that it's where it needs to be. Then I'm going to reach down and disconnect. At this point in time, I'll be able to tear everything off and put my patient in the proper position. So I'm actually going to go ahead and just go straight into a male. All right, so what we're going to do is show you guys the part with the male where it's a little bit different. So I'm going to take this drape and put it directly over the patient. And then my kit is going to be pretty comparable. So you still leave this here like you would with the female. I want to lubricate the tip again just because it's going into a different patient's body part. Now here you definitely want to save this lubrication. I'm going to follow the same process that I did with the female, and we're going to lay it down right here between the male's legs. Okay, here you're going to hold the penis. You want to hold it perpendicular to the patient. If at any point in time you meet resistance, you stop. All right, so first you're going to take your cleaner. You're going to clean from the inside and make a circular motion. And remember, you either drop it or get rid of it. Again, here, clean it from the tip and around a circular motion. And then last one around the tip and a circular motion. Now, some studies do show that you would take the rest of the lubrication and inject it into the patient's urethra. Not all places do that. It does help with some patient discomfort though. So I would inject some of the lubrication if you can. All right, now we are going to again hold the Foley about 2 to 3 inches from the end. As we insert it, you'll see urine flow usually about 4 to 7 inches. So we're going to start to insert. And we'll say we see urine flow. The particular policy that I'm reading says to go all the way up to the Y axis or the Y port. Again, that's kind of a facility specific thing. So I'm going to hold it. We're up at that Y. So I'm going to hold it with my clean hand, just like we did with the female. Reach under with my sterile, and I'm going to inflate the balloon. Make sure you know if at any point in time you're inflating the balloon and you meet some resistance there, you don't continue to inflate the balloon. You might be in the urethra. Take that sterile hand, disconnect here. And get rid of that stuff. You are then going to pull down here, you're checking placement. You do expect quite a bit of that tubing to come back out, and that's okay. As I'm getting rid of my stuff here, you can rip this. You want to make sure that you use this stat lock device on your patient. There is skin protectant. When you use the stat lock, you guys might be able to see there's kind of like a Y shape right here. There's a bigger part and a smaller part. You just put it just like that, the bigger part and the smaller part, and clamp it shut. I like to do this before I put it on my patient just because it helps me know exactly where to put it. I don't want to put it too far down. And then I would take off this tape and adhere it to my patient's leg. I'm not going to do that just because it's a mannequin right now. Make sure that when you do remove it, you remove it with alcohol. When you label, you want to make sure that this goes down below the patient. Make sure there's no loops. But I'm going to show you guys where to label it. You're going to take this little label here, this little square one, and you want to label it on the actual Foley part with your date, time, and initials. Okay, remember this is stuck here. And then there's a long part right here that you're going to tape on the back of the bag. Again, make sure it's filled out and labeled appropriately. Okay, so we have it hanging down on a non-mobile part of the bed. Now let's say our doctor ordered for us to go ahead and remove it. So if I'm getting ready to remove the Foley, you just need a 10cc syringe or whatever size syringe you inject it into the patient. So if you don't know for sure, if you look here, it says inflate, might be a little hard to see on the camera, but inflate with 10 mLs. That tells you how much should be in that patient. It might say 15, it might say 5, all depends on the kind of Foley catheter. So you just connect these here, and you can see some of it's flowing, but you want to make sure that 10 mLs comes out because that's how much is in that balloon. Once we have that 10 mLs out, you can go ahead and just disconnect that. Now what I tell my patient is you're going to feel a little pull, and go ahead and bear down when I do that. So feel kind of like you're pushing out like a bowel movement. So I always put something down to catch any urine that may come out, and then you just pull it out like so. If you meet any resistance at that point in time, you want to stop what you're doing, double check to make sure you've filled out or you've pulled out all the fluid out of that balloon. And if it's still not coming out, you want to make sure to call your doctor and let them know. Then we're going to assist our patient back in a comfortable position. And as always, side rails up, patient's bed down, call light within reach. And that's it.